Welcome to Public Health. Now, the question you might be asking is public health, what's it about? Why do I care about it? What's the difference between medicine? Why is it so interconnected with things like politics and who pays for what and elites and access to resources and the environment you live in and the resources you bring to the table or where you're born determines how you get to live and die? All of that is encompassed in public health. So one of the things that you need to keep in mind, and this is one of the reasons why we use case studies to apply everything you've learned. So every week you'll learn something, then the next week you're going to apply it to a case study. So it's going to be an ongoing addition to what you know and using different methods. These methods are all what we do in public health. So you're learning the tools of the trade and the way that we learn new things, apply new things, change things. One of the best definitions between public health and health, general health and medicine that I've had, and it came actually from a student, was she said that she in the beginning wanted to be a doctor because she wanted to make people healthier. And then she figured out once she shadowed a doctor that she would make one person healthy at a time, but then she sent them back into an environment with bad water or bad air, so their asthma wasn't going to get any better, or she sent somebody back somewhere where there were going to be mental health concerns and she wasn't going to be able to provide them with the ways to avoid that, like different housing or resources so they could leave that relationship, or resources so they could get intensive psychotherapy because she was a medical doctor. So she decided that part of what was making people ill had nothing to do with a physical illness, but everything to do with the environment. And the ways to change that was to help change the environment, to make people more aware, to give people tools to change their behavior. So she decided she wanted to help more than one person at a time. She wanted to help an entire population and have a bigger impact. So she wanted to do public health. But once you go out and big and you want to help lots of more people, as she would say, you have to grapple with a lot of interdisciplinary ideas and concepts that are all going on at once. And that's one of the reasons why when we look at just medical illness health, you're looking at a system of the human body. When you're looking at public health, you're looking at the human body, correct, but you're looking at more than just one person's. And you're looking at how the environment and resources and education and capacity to change, all of those things, and what the government thinks is a priority, all of those things impact upon those people, not just one person, but that community, those people's health. And one of the reasons why medical health and public health are so important is because without your health, you really can't provide for yourself, take care of yourself, go to school. That's all you're doing. You can't be an economic actor. You cannot be somebody who contributes to society. So without your health, you really can't sort of do all the other things, be active in politics, be an activist for change. So you need your health as a basis so that you can participate fully, whichever way you choose, in the society at large, no matter where you're born. So we're going to do case studies. You're going to learn about experiential learning. So you're going to learn from real cases. You're going to do real ongoing health problems in your midterms, and you can look at your syllabus for more of that information. But sort of keep in mind, it's multidisciplinary. You're not just going to know one thing. A lot of people go into public health and they don't really want to do just medicine. They actually are interested in policy change. So also health in general is almost 20% of the gross domestic product of the United States, so public health is a big part of that. And some of the biggest changes you've seen in your lifetime, where people can't smoke indoors, people are being told to get their 10,000 steps every day, the labels you see that talk about sugar and fats, all of that is public health. So the environment is cleaner. You can have a healthier lifestyle. We care about what kind of water you drink. The food is safe, and if it isn't, you're told. All of that is public health, and all of that has a political dimension, all of that has a socioeconomic dimension, but all of that also has encompassed in it that you're an agent of change. And we're going to talk about how all of these factors fit together, but there's something for everybody in this, and it is about making a big change at the very root of all of it, that you care about not just one person, but the entire community, and you're going to be an activist for change, and that's your job.